Welcome, everyone, and thank you for joining us today. My name is Becca Brendel, and I am the director of the Center for Bioethics at Harvard Medical School and the director of ethics in the Chester Pierce Division of Global Psychiatry at Massachusetts General Hospital, where I'm also a practicing clinical and forensic psychiatrist. I'm delighted to welcome you to this event series titled Coffee Sessions, a monthly virtual series hosted by the Harvard Global Health Institute that brings together voices from across the global health landscape working to advance global health equity. I'm honored to moderate this session today, which is being held in partnership with the Center for Bioethics at Harvard Medical School. Today, our goal is to hone in on a single timely question. That is, how to ensure the equitable use of AI in the global health space. In doing so, we turn our focus to governance approaches and ethical frameworks to ensure that AI supports public health priorities and advances health equity rather than reinforcing existing disparities. This session is being recorded through Zoom, and the recording will be available on the HGHI website and YouTube pages in the coming days. We will devote time at the end of this presentation to answer questions from you, the attendees. If you have a question, you may submit it through the Q&A feature on the bottom of your screen. We will do our very best to answer your questions during the Q&A portion of today's event. With that, let me welcome our speakers for today. First, let me welcome Ms. Gabriela Ramos, who is the former Assistant Director General for Social and Human Sciences at UNESCO. She is an accomplished international leader dedicated to building a more prosperous, just, and sustainable world. An economist, diplomat, and policy expert from Mexico, she brings more than 30 years of global leadership experience. Throughout her career, she's played a pivotal role in advancing global agreements and implementing impactful reforms in artificial intelligence, gender equity, international taxation, inclusive growth, education, and climate action. From 2020 to 2025, she served as Assistant Director General for Social and Human Sciences at UNESCO, delivering transformative results, many of which we'll speak about today. Under her leadership, UNESCO emerged as a global leader on AI ethics, anti-racism, and gender equality. Welcome, Ms. Ramos, Gabriela.
Thanks for having me, Dick.
It's a pleasure. I'm also delighted to welcome our second speaker, Dr. Alessandro Blasimme, who is a senior scientist in the Department of Health Sciences and Technology at the Swiss Federal Institute of Technology in Zurich. He has held research appointments at the French National Institute of Health and Medical Research, as well as the University of Zurich, before joining the Swiss Federal Institute of Technology as a senior researcher in bioethics in 2017. In 2013, he received a Fulbright Schumann Scholarship to undertake research at Harvard. His activities revolve around ethical and policy issues in biomedical innovation and biotechnology. His areas of expertise include stem cell biology, regenerative medicine, genetic engineering, digital health, and aging. Welcome, Dr. Blasimme. Alessandro, pleased to have you with us.
My pleasure. Thank you.
So Gabriela and Alessandro, I'm so pleased to have you with us. To get us started off, I've been thinking about and had an opportunity to review some of the work that each of you has been doing really over the past decade. And when I look at the work you've been doing, most of us in bioethics were thinking about global pandemics and COVID at the time that both of you were putting forward really these important frameworks and paradigms for how we should be thinking about AI. And it's hard to appreciate that because now we're all talking about AI, but both of you were really involved in the early stages of this. So to set the stage a little bit, now we're all quite enthusiastic about the potential for AI to help close some longstanding gaps in global health disparities. And then also, of course, concerns that if we get it wrong, there could also be terrible risks. So looking at the current landscape, sort of high level view, I want to ask each of you to start with what you identify as the most promising opportunity for the integration of AI for global health equity. Maybe Gabriela will start with you on that.
Well, I think you put it right you put it in the right context, because at the end, it is not about the technology. I know we all are completely impressed by the folding of protein, or by the diagnostic tools that we can get with AI, and by the improvement in so many decisions that surgeons or people related to the health system can do. But the whole point is to reflect on what are the needs, what kind of world we are confronting, who has access, who doesn't, and how do we ensure that it's not only about the application of AI, because that's, of course, where you start from, but also the investment in the AI that will serve in a very inclusive way. We have seen that because you have only two countries that are mainly the source of all the AI developments, 90% is the US and China. And of course, many of the countries that are advancing the large foundational models are focusing probably in the problems that concern the more advanced economies, the epidemiology of the advanced economies, the solutions for advanced economies. How do we create a system that is really inclusive? Because the real impact is going to be felt in those areas that are always lagging behind. So this is a question. It's a more systemic issue that goes beyond the technology to think about the societies we want to build.
Great. So you already got to the second part of my question, which would be what are some of the things we have to be concerned about? So really the promise for advancing global health equity, but also concerns about that the way we engage both the development of models and the questions that we ask and solutions we try to find being reflective of where they'll be implemented, or where we want to seek inclusion and impact. Thank you for that. That sets it up so beautifully. Alessandro, your thoughts sort of at a high level about what drives you to be working in the ethics of this space in terms of the promise, and then conversely, what keeps you up at night thinking about the ethics and the potential risks of using AI?
Yeah, sure. That's a really important set of questions. I would like to highlight maybe some possibility in which AI can redress existing health inequalities, um, and be more and become an inclusive technology. Although I mean, this needs to be proven and needs to stand the test of time. I would like to pick up three examples. One is the possibility of using AI to foster research on populations that currently run the risk of being left out of the AI transformation because simply we don't have data about them. There is a possibility, for example, to augment the existing research cohort in, for example, low and middle income countries using synthetic data generation through LLM. It's a very exciting field. And if we use it well, we can definitely increase the chances and the likelihood that the AI models of tomorrow will be inclusive of data that is relevant for people that do not live in the global north. So this is an opportunity not to be missed. And then two other observations about possibly what I see also in my own research to be some of the most pressing global health issues of our time. One is one being the impact of climate change on human health and well-being, which is very unevenly distributed across the globe. Some people in the poorest part of the herd suffer those consequences a lot more than others. And maybe AI can be used to model and track the impact of climate change on these populations, and to bring to the international attention, the need to intervene in those areas. By monitoring health, but also by monitoring ecosystemic disruption, for example, through automating the analysis of satellite data. And finally, last point, the aging is happening across the globe, also in parts of the world in which the fertility rate is a lot higher than in the global north. There is a dynamic of aging populations, and it has to be expected that those aging populations are going to start to be exposed to risk factors that are very common in the Western world. So there is going to be probably a westernization, so to say, of global health. And AI could monitor the way in which those populations are being progressively exposed to those risk factors that we know very well. So this is a way of transferring experience from the West to the global South, to the global North to the global South, in a way that is beneficial to these populations.
Great.
And maybe the downsides is that, as Gabriela was saying, the technology is in the end of too few actors, and it's not democratized yet. And this situation entails the risk of control and surveillance that can be exerted by those actors. Regulation is emerging, for example, the AI Act in Europe, but it's pretty isolated case, I would say. So the monopolistic character of AI is a problem, and the lack of regulation is also another big problem.
Okay, so really scoping, you both set that up beautifully, really the sort of high level points about how are we going to use this technology, who will be included, how will models and applications be developed to be relevant to those who we most need them to serve, and at the same time, very specific areas of challenge we're facing as inhabitants of a shared planet, both in terms of bringing our research to be relevant, thinking about climate change, which we know we're just beginning to see what kind of impact data storage and the use of LLMs has on that itself, and then also looking at an aging population. So how do we take this technology then that's really quite monopolized, concentrated in, Gabrielle, as you said, 90% just in the US and China, and then figure out how to democratize and also to regulate, both for safety and to enable development and implementation in the ways that we hope for. Okay, well that takes us really, really far along in why then both of you have been involved with different approaches in governance and ethics around AI. So Gabriela, let's start with some of the work you did at UNESCO, and in particular, the historic recommendation on the ethics of AI, which was adopted by 193 member states back in November of 2021. So can you take a couple of minutes and help all of us really understand, help elucidate what a recommendation of this magnitude offers? What was top of mind when you started this project, and what was the hope of what it would be able to achieve?
Well, that's you can get me like going for 2 hours, but I'll try to be brief. Because the reality is, as you said, we started discussing this in the following a report on the Committee on Ethics of Science, and a recommendation for our dear public is one of the instruments that governments use in international context to agree on doing things. You can have a convention and becomes binding. You need to pass that through your legal systems, and you would need to follow up. A recommendation is non-binding, meaning that countries can just say, well, I do it or not do it. But I think that is not as simple as thinking that countries will not care about it. Because when we build it, you foster a different narrative. It was the very first time that we put the ethics. And I remember countries telling me, we don't need ethics, we just need the technology. And as soon as you start looking at what does it mean to be ethical in any technological development and use, it's not only what Alessandro was saying about inclusiveness, or it's about bringing our values and what we care about to the definitions of this massive development. And therefore, instead of putting the horses ahead of the chariot to do it on the other way, like the two horses behind the chariot, you need to think. And this was a reflection of 193 countries. I was the secretary that was putting the substance in the table, but this was a discussion all over the world. We received 55,000 comments, and it was about putting the human rights respect at the center. We know that these technologies, for example, at the time they were being used to take thousands of decisions by many institutions to analyze data in a very fast way. But then if the algorithm is biased, then what do you do? So this question of the human rights and human dignity was core and center. But then the principles of accountability. If something goes wrong, who is responsible? You cannot say that it's because the black box or because it's generative AI and nobody knows why the thing. Now we're talking about existential risk because of autonomy getting into the systems at not knowing. And more importantly, something that I feel was super innovative at the moment, which was the human determination. And the conversation changed because really when we talked with, and we included a lot of business sector and people that were really related to the development of these technologies, they were saying it's very complex. Because if you are the one that is developing the big models, but then you put it in the market and then somebody else, because of open source, use it and develop something else, and then they put it for something, and then at the end somebody gets harmed because of it, it will be very difficult to trace it back. But at the end, I think that we are making progress because of these definitions that at the end were agreed and owned by so many countries that start looking at those very important issues of liability regimes. And something that is super important, Becca, that it has really been the core at the issue, thinking about outcomes. Not thinking about, I'm going to be controlling, of course, you need the regulations to see that you have quality data, or you need the regulations to have evaluations, or to have the red teams and all of these things. But what is very important is that we cannot be chasing the technology. We cannot be looking at breathing down the neck of the developers. It's impossible. We don't have the means, we don't have the skills, we don't have, but we know when something goes wrong. And if you are discriminated, if you are applied a treatment based on AI in the hospital that gets you worse, these things, the outcome based, I think is really important. And then I did something else because I thought that being a recommendation, I didn't want to be just a nice whispering in the ear of countries, but also holding them accountable. So we developed the readiness assessment methodology to get engagement with all the countries and see where they are, not in the use of the deployment of AI, but in their capacities as governments and institutions, as legal frameworks, to try to define the best tools to steer the development of the technology in a positive way. I left UNESCO because I was running for the Director General job. I have been there not for 1 month. And the fact is that we finished with 80 countries doing it. And you know what happened? Ministers from the Global South, from Mozambique, from Cambodia, from Vietnam, will come to me and say, thank you so much for the readiness assessment because it has put us in the driving seat. And therefore, I know now what I would like to do is more complex than that. The technology is global. There's a power imbalance. All these things are real, but at least you help countries level the playing field and their knowledge, understanding better what is going on, and setting a direction of where we want to go. And I think that we really achieved something very, very close to that.
Great. There's so much there, but I think the lesson that really stands out and the experience that really stands out is that the active work that it took both to center the values first, so that it wasn't playing, that the values wouldn't be just in catch-up mode, as you eloquently stated, but also really using the recommendation to help empower countries to develop readiness, to develop their voice, and to try to begin to address this power imbalance. That without this kind of attention, we would be in a situation where those who were already developing the technology are the ones who are dictating how it's used or how it's implemented. Really important, and also that that even if a recommendation, or perhaps especially because a recommendation is non-binding, the kind of opportunity it could create for market shaping, so to speak, in a way to promote the readiness and the adoption in the places where it's most needed and least likely to happen. Thank you so much for that. And then Alessandro, you've taken a slightly different approach to it, really, but also really centering and starting in ideas about what ethical systemic oversight would look like to address the pace and complexity of evolving AI. So can you talk a little bit about the approach that you've taken to this, and maybe give some examples as well of how a model like the one you've put forward, the affirm model, or this idea of systemic oversight is imagined to work, how you saw it when you first put it forward?
Yeah, absolutely. So my work revolves to a great extent around understanding which governance models are fit for purpose in the space of AI in human health. And there are many options on the table, of course, and one mainstream option at the moment is to forego governance altogether. This is also a legacy of the fact that the dot-com industry, the digital platforms have grown immensely in the absence of much control and governance and regulations or restrictions. So now we are, however, talking about how these technologies can play a role in a highly regulated space like human health. And we need to come to terms with the specificity of this field. So our idea of systemic oversight is really about making sure that there are mechanisms and processes in place throughout the life cycle of clinical AI, from code to care, so to say. And I mean, in order to be more concrete, I might, ask the audience to imagine you are responsible for digital transformation, AI integration, say at an hospital trust or in a public health agency. So how do you go about um, taking care of the opportunities that AI has to offer, while at the same time being conscious of the ethical shortcomings that we're all aware of. Now, the systemic oversight approach boils down to, let's say, 6 governance principles. Now, I don't want to be didascalic, so I will keep it rather conversational. So, a first pillar has to do with the fact that, as I just said, AI is evolving with a very uncertain within a very uncertain regulatory ecosystem. And in a nutshell, I would say that compliance is necessary, but it's not enough. So oversight mechanisms should be set up to ensure that what happens in health systems maintains accountability for those deep technological transformation. And one very easy way to do that is to define the expected outcomes of each AI model that you deploy clinically or in public health. So being specific, defining what do you expect, what good do you expect AI to bring about, and how you measure that. So what are your KPIs, so to say. And this is a conversation that is not easy because basically everybody is rushing to adopt AI just for the sake of it. And there is a presumption in favor of automation that it will save cost and make better decisions than humans. But you really need to spell out what you want the technology to achieve. Where do you want to save, if you want to save, how you want to better distribute positive health outcomes. The other pillar has to do with making sure that oversight mechanisms are adapted, well adapted to what the AI model is supposed to be doing. Not all AIs are born equal, so to say. So one thing is to talk about AI in the space of healthcare management, and another thing is to talk about a device that performs diagnosis or automates patient monitoring or epidemiological surveillance. In each of these cases, there is not only one way to go, and there are specific needs in each of these use cases. So oversight mechanisms should be use case specific. Inclusiveness is of the utmost importance. So practices like co-designing, co-creating, and co-monitoring AI with end users and patients or populations in the case of public health is really important. I think it's easier to imagine co-creation at the level of an AI-driven medical device, but when we need to engage communities and population, I think that there is a longer way to go, but it's necessary to go that way. The last couple of things that I would like to highlight is that AI deployment in the space of human health needs to be reflexive. So as I said, we know what the ethical pain points are. For example, algorithmic bias and fairness. We also know that there are mitigation strategies available. You need to justify your mitigation strategies. So we need to be ethically accountable for the tools that we deploy to mitigate ethical risks in AI. And unfortunately, we don't have a uniform ethical framework like we have, for example, I don't know, in clinical research ethics. And this can be a problem because everyone is going a little bit in their own direction. Last 2 points, really, monitoring needs to be active because the performance of AI models deteriorates over time. It's a very well-characterized phenomenon. So models will need to be recalibrated, retrained, maybe disposed of and replaced over the course of time. So active monitoring should be in place, which entails also that you define your evaluation and adaptation cycles from the get-go. You don't wait for problems to arise before you respond to problems. You really need to be proactive. And I think that this is basically, in a nutshell, like a sort of implementation outlook of what systemic oversight might mean in concrete cases. But I'm happy to elaborate more.
Great. So that really goes beautifully hand in hand with where we started with Gabrielle and thinking about governance models and what we can do at the level of states, and really both avoiding an overly cautious or precautionary approach that would lead to slowing down the development of tools and systems that could be quite impactful to health, especially in the global south, but also avoiding what could happen if we just wait and see, as you say, right? If we just wait until the problems happen, then we're playing catch up in a way that's probably not possible, certainly not sustainable, but would go against what you're both really focusing on, which is centering the values from the beginning, making sure that human rights, human dignity, and our commitments to health and responsibility in medical spaces is assured and centered as these tools and models and systems are developed. So 5 years is a long time and a short time. If we think of what's happened since the UNESCO recommendation was adopted, or we look back to when you began thinking about the systems oversight, Alessandro, a lot has happened. Large language models, GPT-4, now many subsequent iterations, models, and advancements have come forward over just the last about 2.5 years. So all of this came forward before we were seeing really the widespread use and adoption just in daily life. I'm wondering I'm wondering what your assessment is now of looking back. Or do we still have the tools we need? Is it time to how is the recommendation done, Gabriela, when you look at just how quickly the explosion of AI has been societally, across the entire planet, right? Just accessed from a smartphone with a satellite link, for example. Anyone can get into an incredibly powerful LLM to power their lives, and that goes into the health space, whether or not we intended it. So how is the recommendation done? What have been some of the successes, and where do we go from here?
Well, you're completely right. The fact is that the tension is still present, but higher stakes. Because what happens is not only that you have the ChatGPT 3 and 4, and then you have the agentic AI, and now we're having reasoning AI, and no, it's just what is happening is that these technologies are more and more excelling in cognitive functions that were just in the realm of human beings. And we also see the competing incentives of companies that are locked into the geopolitical space, profit-driven, massive investments that need to have a return to investment that maybe it will never show because it's just huge. Companies that are born non-profit and then became profit-oriented, and with the engagement model that we know was so negative for the social networks platforms. So I feel that the tension is already there. On the positive side is that the cost of applications have reduced by 90%. Open source have opened an amazing space of something that we have been pushing forward, because even if you are Mexico, I'm Mexican, we are not the big players that is going to be determined what kind of rules apply to this big tech, or how do we ensure that the incentives are there not only to be profit driven, but also to think about inclusiveness. But the fact is that you then turn the question towards people, governments, and institutions to think about what kind of rules you need to have to create other incentives for the deployment of certain applications in very specific fields. And I feel this is where the recommendation was very useful, because since the very beginning, we were pushing for the sense of agency, not to just think that it falls from the sky and you need to just take it as it is. We have now more options in the markets in terms of what kind of tools you can use to develop your own things. But then the realization that the frameworks and the policy tools that governments have mean something. And this is great because, for example, with Chile, we were discussing with them the readiness assessment, and they realized that there was no big platform for Spanish, and they launched the ChatGPT Latam. They noticed that the protection of privacy and their data was not as strong as it should. So little by little, you go to see that one thing is to say, okay, we need very specific regulations for when the development of these large foundation models take into account the impact that they can have. But you have a lot of legislation that are already there that we need to move forward to cover for things that might happen in the cyberspace. So it's not that we are not well equipped, it's that we need to be thinking, property rights. I was very pleased to see the outcome of this legal case of the workers in Hollywood, because it's true. At the end, how do we apply the long, very well-known IPR laws to the cyberspace? So I feel it's there where we are finding that countries and people are starting to understand that it's not only about being a witness, what is going on in the cyberspace, but becoming an actor and using the tools you have. Just one very concrete example. You see the competition, the global competition, China, the US, between the big tech trying to sell their programs and trying to be the ones that help the countries to advance their own infrastructure. Imagine if countries will be using their procurement systems to say, okay, it's fantastic because the tools that we have, for example, to get the health systems to be more efficient, to support the doctors with their administrative tasks, to ensure that they can also have this array of information to improve their diagnostics. Well, imagine if the governments start saying, I'm gonna engage with companies that follow these rules, some conditions. Procurement systems are 15% of GDP in OECD countries. It's a very powerful tool. And therefore, let's just turn the conversation around, because it's not only about the amazing developments, which we need to take advantage of, but also to think, how do we shape our own ecosystem with our tools, with our policies, with our competencies, to ensure that they deliver what we want them to deliver. And in this sense, there's so many things to do that can be just, Alessandro mentioned the question of Europe. Europe, I think, is mal represented, because they always say, "Oh my God, heavy regulation, bureaucratic." No, what Europe is saying is, if you are going to put the risky development in the market, I need you to show me your cards, and to make sure that you run all of the tests that you had to run, the adversarial testing, the outcome-based testing, before you put it in the market. I mean, that's what we do with highly regulated industries like the pharma. Why shouldn't we do it with the big technologies? And I feel this is where we are in the people and countries learning how to frame the issues in a way that is not just the technological champions, but also each one of us who decide how to use and how to take care of these developments in a way that deliver for our own outcomes. And I feel that we have moved forward. It's not a Pollyannish perspective, but I'm more encouraged to see that people are taking this in their hands and understanding that it is about themselves and about their systems that need to be put up to the task to, as I said, steer this revolution in a much more humane way.
Right, that's such an important perspective, both about how shaping frameworks can empower the use of other existing frameworks, that we don't have to make every approach novel just because we have a novel and rapidly advancing technology, but actually create the conditions where we're asking the right questions and leaning on what we know by having given guidance in places that we're facing new kinds of challenges. So I want to make sure that we have some time for to take questions from our attendees, and they're starting to pour in rather quickly. So let me go to one that I think will help us continue to engage this question about the application of different types of frameworks and approaches. So the first question really looks at countries that are not necessarily strong in their technical capacity, but really have been quite intentional, very much in this vein, Gabrielle, that you've been talking about having strong and intentional AI governance frameworks. So our listener specifically is talking about developing nations, including Rwanda and Kenya, for example, that really have been quite intentional on governance frameworks, even though there's not a lot of technology itself being developed there, at least not right now. How can the global North best help encourage and support these kinds of efforts, really to develop these intentional governance frameworks and see that they do inform the adoption of technology in the global South. Either of you want to start out on that?
Yeah, maybe just a quick reaction to that. Well, there are several ways to leverage on those more intentional stances on the part of certain countries. I mean, a basic way to do that is to partner in research with these countries on validating those governance frameworks. This means being open to deploy financial resources in those countries in a way that is, let's say, acknowledging of the goodwill of these countries to really make a difference in how this technology is brought to that part of the world. So helping them, providing research resources and partnership through international cooperation, but also through normal channels of research funding. And then there is another thing that comes to mind, also because Gabriela was mentioning the European experience. There is a discussion these very days in Europe about the possibility of creating a public center for research on AI, modeled on the CERN Center for Nuclear Research. That, by the way, was at the origin of the World Wide Web back in the days. And it's not an isolated example, because if we look closer to our field of practice, also the Human Genome Project represents a public effort to foster technological development that resulted then in genome sequencing technology being available to laboratories across the world and to clinical centers across the world these days. It's very early on to assess the likelihood that this European initiative will succeed in creating a new mindset around AI. But as a matter of fact, it's something that I think we need to hope is going to give results, because the current model is entirely driven by private corporations that are already having strong entanglements with governments and other companies. They, as we said, operate in a pretty monopolistic way, and they represent gatekeepers inevitably. So I don't think that we need to necessarily deploy like a public open source LLM as the only solution to these problems. But I think that establishing a long-term plan to do research around how AI can best serve public interest could shift the tone of the discussion. I'm sure that everybody who is in the conversation today has heard about OpenAI starting to accept advertisement on its platform. This was just a matter of time. Actually, their business model at the moment doesn't produce cost. Each time we query ChatGPT, they lose money. So precisely given the huge amount of investment that these companies are undertaking, they need to create revenues. And I don't think that they're going to do it in a way that is very much different from social media platforms in the end. They're going to try to legitimately lock their users in and and put advertisement on their platforms at the end of the day. I don't think that this is very promising if we have to put at the fore human values, human rights, equity, dignity. I'm not saying that they're going to run contrary to those values, but I'm just saying that we cannot hope too much that those values are going to be respected or promoted if this is the direction of traffic. So I would say that more maybe involvement from the public sector is to be looked at with hope, although also we know that this is not the magic wand to solve the problems. But I'm very much hopeful that more conscious, reflective ways of developing and deploying AI will emerge in the years to come.
Yeah, Gabrielle, I'd love you to jump in on this because on the one hand, it's what we you're both hopeful about the potential to continue a democratization, so to speak, of implementation of AI, especially in health spaces. And you cited some really important changes that had happened over time, like the cost coming down, open source models, ways of bringing data to make tools more inclusive globally. So now, after all this investment, certainly there has to be some source of revenue to continue to sustain the growth and to develop these tools. What are some of the things that you've been seeing, or in the ways in which the recommendation has been market shaping in positive ways? Are there lessons we can learn from that, or how would you see this going forward in a way that would continue public engagement and values-driven shaping in procurement in other spaces, so that we don't just go the way of whoever is willing to fund it or advertise is going to, again, have an outsized influence that your work really tried to operate against from the very beginning in principle and in implementation?
No, well, I think that Alessandro mentioned some very good points there, because the fact is that if you think about the asymmetry of the capacities of those that are developing the technologies and those that are needing to have solutions for their own problems in Africa and Latin America, is just huge. And therefore, I feel that what is very important is that we continue to reduce that asymmetry of understanding how the technologies work. Let's not put that aside, because we can then go for more higher level issues. But at the end, it's also true that, I don't know, but the large share, I think it's almost 75% of the research that is being done about the technologies is being done by the big tech. It's the very first time that we don't have, for example, the US government, who's always a provider of amazing amount of research on these areas. It cannot be private research only. And therefore, I feel that the creation, for example, of the safety institutes, it was the UK who started, but now you have many countries in the global south thinking, how do I invest? And everybody can invest on those things. Everybody has, even if you are a very poor country, you will have some tax money and prioritizing the understanding of how to apply those technologies. So I feel the institutional building to invest in research and to tailor the understanding of the developments to the needs of the countries is something that I'm seeing happening, and is great. Is of course, when you see the safety institutes, the leading one is of course is the UK and Japan and France, and of course the US is doing a lot of research, and institutions like Harvard is also super a great source of understanding. But we need to tailor it to the countries, and that's where the recommendation was also good, because it's not about only getting what comes from the outside, but looking what are your strengths. One of the things, Becca, that I decided was, and was not easy, but I decided I didn't want to have only the experts of the global north going to do the readiness assessment in the global south. We did was to identify experts in the global south. And I was super proud that even, I mean, you will not imagine the Minister of Digital of Somalia coming to talk to me. And I was like, but you have so many other problems. Like, well, yes, but I don't want to have an additional problem, that is that I was completely lost in this global conversation. And he was looking really how to bring or how to invest in the engineers in Somalia. In Somalia, there are people studying engineering. Well, he was thinking, how do I improve the teaching of engineering to include elements of what they need to know about these technologies. So I feel is again getting the conversation back to the realities of the global south, to the very specific needs of each single country, and then defining what kind of capacities they want to bring up to understand better the technologies and to shape it. Institutional building for me is super important, and it's not us. I was really happy, for example, the Moroccan lady, by the way, because it's only 23% of the workforce in the AI world is women, and so we are also lagging behind in that space. The Moroccan lady that did the report in Morocco was called by the Chileans because they wanted to test some issues of what Morocco, the Minister Amal Lefal she's fantastic, and they were exchanging. So I think this is the space where I feel countries can learn. The Indian summit that I was there last week, it was great because people say, oh, but what purpose of this big summit have? Nothing happens, nothing now, because everybody wants to have like a one breakthrough that will change the world. Well, it does not, but it connects people. It allows for engaging, it allows for exchanging, it allows for learning from each other. And I feel this is what gets me positive in terms of countries realizing that they need to upgrade it. But I also was very proud that when we did the readiness assessment, of course, you have the expert doing it, but it's not about the experts. We created the steering committees that brought the voices of those that are never heard, the indigenous communities, the people that are usually marginalized, people that are not usually in the circuits, even in those countries that are the decision makers. And therefore, this push also to ensure that because this is a global transformation that is going to affect every single one of us, that we're also making the effort to ensure that when you go for consultations on developments of this technology, you also not only speak to the usual suspects, but you make a little bit of an effort to go there and to speak to people that might not even know what you're talking about, but they have an iPhone and they know that the decisions that are going to be taken in the financial sector in the global south, or because you're using these technologies, might affect or get you into trouble or get you outside of the scope of the benefits of this technology. So I feel it's again the institutional building and the agency back where it belongs.
This is great. We have so many great questions that are coming out of this conversation, and unfortunately, so little time. So I want to highlight some of the themes that have come up in the questions from our audience, and then I'm going to ask each of you just to give us some of your closing thoughts and maybe bring to us one thing you think attendees can do or hold on to after our conversation this morning to be part of this positive momentum towards global health equity. But the kinds of questions that are coming up, and I really want to share these so we can all have them back of mind, but right now front of mind, but as we go forward in our work, back of mind to inform inform our impact. Questions that arise frequently in global health, now coming up in the context of AI. How do we think about the trade-off between maximizing overall health impact and also prioritizing equity by reaching rural, excluded, and so-called last mile communities that could benefit? Really thinking about the minimum system level oversight that we should demand to make sure that our interventions are safe. Thinking about the kinds of education and experience we should all have, but in particular, those thinking about ethics and governance. And then maybe a question we could all come back and have an entire session about: how do we think about who should hold the intellectual property or the rights in the development of AI models? Very much something that's coming out in terms of ownership, responsibility, transparency, and of course, liability. So just a couple things for us to think about. But as we sort of pull that together in just our last few moments together, if there's one take home point or one take-home example you'd like our listeners to go away with today in your sort of lightning answer in just a minute or so, what would that be? What should we be thinking about? Alessandro, you want to go first?
Yeah. Well, I'm very fascinated about this question regarding the last mile. I mean, in certain areas of the world, it's probably the last 100 miles before people achieve what they need in terms of healthcare, and even when we're talking about basic healthcare needs. But this is definitely one area in which AI can make a difference because in general, even in low middle income countries, mobile technologies are pretty pervasive and distributed pretty granularly, even in rural areas and remote areas. The point is that the kind of devices that you need to run AI today are not affordable in those contexts. An iPhone is not an option in certain areas of the world, or equivalent devices. So I really think that we need to possibly start thinking about forms of point of care AI in which the technology maybe is shared among people, and it doesn't need to be a complicated infrastructure. I mean, maybe a smartphone is sufficient to serve the last mile needs of hundreds of people in certain areas of the world. So we need to be able to deploy AI systems that can work in this way, that can reach deep into communities. However, it cannot be done without involving those communities. It won't work. It won't work out. We cannot always think that the fix is going to be technological. The fix is always, in the space of global health, is always primarily social. And we need to find ways in which the technology can be socialized and can be made part of the tapestry of communities, and communities can feel empowered and not controlled or dominated by that.
I'm going to have to stop.
Yes, I'm stopping there.
Sorry,
I'm
no. I'm
stopping
sorry.
there.
I'm going to have to stop you
Absolutely.
there because I want to make
Yeah.
sure that we get a final closing point from Gabriela, and then can get everyone on to their mornings, afternoons, or evenings, wherever it might be in the world. Gabriela, final parting thought about what you'd like our attendees to keep front of mind as they go on and we all do our work towards advancing global health equity through AI.
I would say that we need engagement, we need understanding, and we need awareness. Global South, of course, we might think there's nothing I can do. Yes, there are lots of things we can do. We can engage in philanthropy. We can engage with holding a community, adopting a community. There's so many things that the Global North can do for the Global South. But more importantly, I feel that we are not understanding the social impact and the health impact of the use of these technologies. And I feel this is the responsibility of each one of us to ensure that we do not become dependent, that we do not take AI for granted, that we don't think that everything AI do is right, and that we always keep this critical thinking that will help us to ensure that it delivers for what we need and not the other way around.
That's such an important point to end with, exactly where we always start with, listening to the voices of communities and empowering those who would be the recipients of technology in defining both what the need is and how we hold ourselves accountable to that. Fantastic. This has been such a privilege, and I've learned so much from both of you. And thank you so much for joining us in our conversation this morning. Really, both insightful, a lot to think about, but even more importantly, inspiring to take that thinking and put it into action in ways that we can transform lives and communities. As we wrap up, I encourage everybody who's with us today to mark your calendars for our next event, which will be on March 27th. And thank you so much, Gabriela Ramos, Alessandro Blasimme, for joining me today. And thank you to all of you for your wonderful questions and engagement. And I hope you all have a wonderful rest of your day. Thank you so much and take care.
Thanks to you.
Bye-bye.